Good day everyone, my name is Miguel o Apat, and today I am going to perform assessing the abdomen. Procedure number 1, assess the client's physical and psychological aspect before and during the examination. Rationale, allow healthcare provider to gather complete data about the client's health status. So, good day ma'am. Meron po ba kayo nararamdaman sa tiyan niyo po ma'am?
Yan.
Masakit po ba? Wala.
Po.
Thank you. Procedure number 2, review the body areas to be examined. Rationale, health examiner or health care provider to identify which part of the body is to be examined. So mag-i-examine po tayo ng iyong abdomen po ma'am ngayong araw.
Okay.
Next, procedure number 3, make a physical and environmental preparation before examination. And for the rationale, proper preparation of environment, client, and equipment ensures smooth physical examination with less interruptions. Next, procedure number 4, we're going to gather and take the health history of the client. For the rationale, to have a comparison from previous illnesses and present health condition. So, na-mention niyo po kanina ma'am na hindi po masakit yung inyong yan. So, before po ma'am, nakaranas po kayo ng sakit ng tiyan po ma'am?
Yes.
Yes. O kung i-rate niyo po yung sakit ng tiyan niyo po ma'am from 1 to 10, ilan po yun?
7.
7. Thank you. Next, procedure number 5. Conduct physical assessment of the abdomen using force skill in assessment. IPPA, inspection, palpation, percussion, and auscultation. And for the rationale, to assess, determine, and identify abnormal findings in the body system. And to auscultation should be ahead of percussion, and palpation in order to properly hear the abdominal sound. Now, for the inspection of the abdomen, procedure number 6. We are going to inspect the abdomen for skin integrity, and for the normal findings, it should be unblemished skin and uniform in color. And for the abnormal, presence of rash or other lesion, tense, blistering skin may indicate ascites or edema. So, i-inspect lang po natin yung abdomen nyo po ma'am. Okay lang po ba?
Okay.
Thank you. Next, procedure number 7. Inspect the abdomen for contour and symmetry. For the normal findings, it should be flat, rounded, convex, or scaphoid concave. And for the abnormal, it is distended. Next, ask the client to take a deep breath and hold it. And for the rationale, this make an enlarged liver and spleen more obvious. And for the normal findings, no evidence of enlargement of liver and spleen. And for the abnormal, evidence of enlargement of liver and spleen. So, ma'am, pwede po kayong inhale, exhale po. Deep breath po.
Okay.
Para inspect ko po yung spleen or liver niyo po. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Thank you. Next, if this tension is present, measure the abdominal girth by placing a tape measure around the abdomen at the level of umbilicus. And for the normal findings, symmetric contour, and for the abnormal, asymmetric contour. We measure up natin yung niyo po ma'am. Next, procedure number 8. Observe abdominal movements associated with respiration, peristalsis, or aortic pulsation. And for the normal findings, asymmetric movement caused by respiration. And for the abnormal, limited movement due to pain or disease process. So, i-inspect lang po natin yung abdominal movement po, ma'am. Inhale ka po, ma'am. Exhale. Inhale. Exhale. Inhale. Exhale. Thank you. Next, procedure number 9. Next, we are going to observe the vascular pattern. And for the normal findings, no visible of vascular pattern. And for the abnormal, dilated veins. So, inspect na po natin yung Now, for the auscultation of the abdomen, procedure number 10. We're going to warm the hands of the stethoscope diaphragm and then auscultate the abdomen. And for the rationale, cold hands and cold stethoscope may cause the client to contract the abdominal muscle. So we are going to warm the head of this stethoscope with our hands. Next, procedure number 11. Ask the client last 8. Rationale. Shortly after eating, bowel sounds may normally increase. So, ask ko lang po, ma'am, kung ano po yung last na kinain niyo po, ma'am, o kailan po last kumain?
2 hours ago.
2 hours ago. Thank you. Next, procedure number 12. We are going to place the diaphragm of this stethoscope in each of the 4 quadrants of the abdomen. And for the rationale, to assess all areas of the abdomen. And for procedure number 13, we are going to listen for active bowel sounds. For normal findings, audible bowel sounds consist of clicks and gurgles. And 5 to 30 per minute, occasional borboids, must loud prolonged gurgle may be heard. And for the abnormal, hypoactive bowel sounds and hyperactive bowel sounds. So, ano po natin yung ma'am, bowel sounds niyo po, ma'am. Now, we are going to percuss the abdomen. Procedure number 14. Percuss areas in each the 4 quadrants. For the normal findings, symphony over the stomach and gas-filled bowels dullness. And for the abnormal, it is dull. So, i-percuss po natin ang abdomen niyo po, ma'am. Thank you po. Next, now for the palpation of the abdomen. Procedure number 15. Warm hands and perform light palpation first to detect areas of tenderness and or muscle guarding. For the normal findings, no tenderness, relaxed abdomen with smooth, consistent tension. And for the abnormal findings, tenderness and hypersensitivity, superficial masses, localized area of increased tension. And for the rationale, cold hand elicit muscle tension and thus impede palpatory evaluation. Thank you. Next, procedure number 16. Perform deep palpation to detect areas of tenderness and or muscle girdling. For the normal findings, no tenderness, relaxed abdomen with smooth, consistent tension. And for the abnormal, tenderness and hypersensitivity, superficial masses, and localized areas of increased tension. Thank you. Next, procedure number 17. We are going to palpate the bladder above the symphysis pubis to detect urinary retention. And for the normal findings, no, not palpable and no distension. And for the abnormal, palpable and distended. Now, for the evaluation. Procedure number 18. Make findings on health assessment and physical examination done on the client. And for the rationale, these are important data to convey the physician aid in diagnosis of the patient. And for the documentation, procedure number 19. Document and report any pertinent findings during assessment to appropriate personnel. And for the rationale, to provide accurate data in the care of the client. So, tapos na po tayo sa assessment. Ano po nararamdaman niyo po, ma'am? Meron po kayong naramdaman sakit po, ma'am? Wala naman.
No.
So, thank you for the cooperation po, ma'am.
Okay.
Thank you. Now, we are done on assessing the abdomen. Thank you for watching.